Thank you. Probably one of the most common questions that we're asked is, what is holistic dentistry? And probably one of the least common questions we're asked is, what is the connection of holistic dentistry to anti-aging? And yet the answer to both those questions is very similar. It's the same, in fact. Holistic dentistry is really all about just linking oral health to general health. And the aesthetic part of it, of course, is if you enjoy smiling and talking to people, teeth and your oral cavity play a fairly important role in that. It also surprises me, actually, how often, or as I talk to a lot of health practitioners, how often the oral cavity is just completely ignored as a part of the whole health picture. And perhaps that's got something to do with the fact that we all feel a little nervous about being patients in the dental surgery. You know, opening your mouth in into one of the most sensitive areas of the body. It's a very vulnerable position, and we all have our day as patients, and perhaps that affects our focus on the oral cavity as an area that we should be considering when we're looking at overall health. But when you look at the orofacial region and you consider the amount of neurology that is in this area, 30 to 40% of the sensory cortex is made up of the orofacial region. Now, what does that mean? It means that when you bite together, your teeth can sense 7 microns. What does that mean? A hair is 21 microns, so 1/3 the thickness of hair is what can be picked up from the proprioceptors around each and every tooth in your mouth. The implications of that, of course, and the interconnections between that and the autonomic nervous system are quite profound. Similarly, the motor cortex, again, 30 or 40% of the motor cortex is made up of the orofacial region. And neurologically, that has profound impact. When we bite together, our teeth in function, and what I mean by function is when you are eating, 3 or 4 meals a day, when you are talking, whatever you talk, when you swallow, 1,500 to 2,000 times a day, each time you do that, your teeth touch. And each time your teeth touch, the muscles traditionally thought of as mastication, the temporalis and masseter and medial pterygoids, they contract. And if you add it up in a 24-hour period, how often that should happen, it should happen for a total of 15 minutes a day, 30 minutes max. So for 23 and a half hours, the teeth aren't meant to touch and these muscles are meant to be inactive. In fact, rest position is with your tongue on the roof of your mouth, your teeth slightly apart, your lips lightly touching, and you're breathing through your nose. That is ideal rest position. However, if you clench and or grind your teeth, and frequently people do that in their sleep, oral motor function has a profound impact on muscles throughout the body, and we'll look at that as well. So, as well as that, when you look in someone's mouth, you notice it's very pink and there's a lot of blood supply very close to the surface, and there happens to be somewhere between 400 and 800 different microorganisms in the body, in the mouth. And when we're out there hunting and gathering, picking berries and digging up roots and killing animals and eating them, those microorganisms are in perfect balance. However, if we're not doing that and we live on a Western diet, then that presents us with some challenges, and in fact the 2 most common inflammations or infections in the body are periodontal disease and tooth decay. Now, periodontal disease has come in for a great deal of attention in recent times because in the last 10 years in the profession, and I think a lot of general health, it's been implicated in a whole range of health issues, from cardiovascular disease to diabetes, to osteoporosis, to low birth weight in children. There's also some very interesting article just recently linking periodontal disease as a predisposing factor to pancreatic cancer. And why would that be? Well, excuse me, I think inflammation is now being recognised as a very important process in a lot of these disease processes. And where is the most common inflammation in man, woman or child? The oral cavity. So another area that the orofacial region has a significant impact on general health, and also amazes me of how little general health practitioners actually focus on this, is that as a profession we probably implant more materials into people's bodies, although I do wonder when I look at some of the things going on that I've seen this weekend, but I'm still going to say this, and I think it's true. We implant more material into people's bodies than all other professions put together. People have fillings. People have restorations done. A lot of people have fillings and a lot of people have restorations done. So our choice of material is critical, because the issue of implanting a material which has the potential to be toxic to a person's health has significant repercussions for their general health as well. Another area that's interesting is the effect of our oral cavity. I mean, it is the first step in the digestive tract, and the function of the masticatory system is an important part of how well people digest their food. It's also part of the airway. I mean, ideally, as I said to you about about ideal rest position is with the tongue on the roof of the mouth, and ideally, in a breathing sense, we are better to be breathing through our nose for a whole range of reasons. But that, unfortunately, in our society is not the case in actually a good majority of patients. The majority of patients are mouth breathing, and that has a great deal of implications on posture and on our general health. As well as that, sleep has become a very important aspect of dental practice in the last few years, and actually it's interesting because the Dalai Lama was asked, what is his secret to happiness? And his answer was 9 hours sleep a night. And I don't know of anybody that gets 9 hours sleep a night, but when we start to explore the quality and quantity of sleep, that also becomes a significant part of a holistic dental practice. So let me just share with you, because we have got a limited time, and as Peter said, this is the subject of a 2-day program for health practitioners, but I just want to give you a taste of some of the things that you may not be considering when you're assessing the health of your patients. The first challenge for us is really, and actually, holistic dentistry linking oral health, general health. Well, Professor Pollard this morning was talking about optimal health, wellness programs, and optimal health is certainly our goal in treatment. But as we get older, it's not just a goal, it's a necessity. If we're wanting to age and age well, optimal health is absolutely critical. So there are several challenges that impact on general health, and one of them is, as I said, to reduce chronic inflammations and infections. And let me just share with you some of the things we see on a daily basis, and here, quite simply, there is calculus built up around the gum, and the gum should be like a tight collar around each and every tooth, and if you measured the crevice around each tooth, that should be about 2 to 3 millimetres, because that's firm, it's healthy, it's easy to keep clean with the bristles of a brush. But when you start to get build-up of deposits, or you start to get pocketing down the side of a tooth, you're going in there brushing teeth, but clearly this is an area that's being missed. So 90% of the tooth surface is being cleaned, but the part that's in proximity to the periodontal tissues is not. And this is highly vascular and crawling with bacteria. So when we remove this, of course, this is the inflammatory. I mean, look, when you look at how red and puffy gums are, and this is just a very simple, everyday thing we see and probably would see in every person in this room at various points. So the response to the tissue is extremely good. And, within a 2 or 3 day period, gums should be starting to look like this, pink, firm and healthy. And the chronic inflammatory state that periodontal disease elicits is an issue for the whole body.